I'm Dr. Ashi. I'm a licensed clinical psychologist and psychotherapist. I'm a big fan of Dr. K. He's a psychiatrist. He also has written a really great book about gaming addiction, video game addiction. It's called How to Be a Healthy Gamer, and I think it's great. Um, I saw recently that he is on Jubilee, which is a YouTube channel that does a lot of debate content. Now, Dr. K is someone who I've seen a lot of his work, and I think he's a really reasonable, very, very educated. He really knows his stuff. But I think on a human level, on an interpersonal level, he's a great listener. He has a lot of empathy, and I think he's genuinely curious about other people. I think that's what makes him great at his work. And so I was curious to see how this format would work with him when he's not going to just go up there and get argumentative or push back against people. It's for educational purposes. Obviously, I'm not diagnosing anyone in this video. It's just to kind of talk about the ideas that are coming up.
My first surrounded claim is you're not broken, you're overwhelmed.
Their claim, I'll say for me personally, I feel like I was broken.
Yeah.
I went through my uncle passing away, and then the next year my grandfather passed away, and I felt like
Oh, God.
a part of me broke. When he went, a part of me died with him. So
Sure.
when I went through my throes of depression, which I'm still in it, I have my days, my good days, my bad days. I kind of went down that path of like, I lost a part of myself I can't get back. I can't fill that void. I can't fix it. I can't mend it because they're not here anymore.
A lot of people, when they go through some traumatic event or loss, a death of someone, or really just anything that's gone on in their life that's difficult, we can feel broken. And that's really the only language that we have to describe the pain that we're feeling. And so some people might say depressed, some people might say broken or traumatized, or I think the language that we use is usually signifying how we feel. And that's okay. Something that we talk about in cognitive behavior therapy is that there is a relationship between our thoughts and how we feel. And so right now she's saying, I can't get better, something like that, or I'm broken. If you're telling yourself, I can't get better, those are your thoughts, or I'm a broken person now, I cannot heal, and you continue to have those thoughts years after someone passes away, then it's going to be difficult for your emotions to move on from the experience, right? You're kind of get stuck. I don't know what Dr. K is gonna say here. My guess is that the first thing he's gonna do is really try to understand this woman, what she's feeling and why she feels the way she does. I'm not sure when he's gonna move it into the overwhelmed piece.
I think this is one of those claims that I sort of agree with you already.
Yeah.
When we lose someone, that person's gone forever.
Yeah.
And we're never getting them back.
Yeah.
And it also sounds like he was a really important part of being a safe space for you, someone that you could talk to,
Yeah.
right? Can you tell me a little bit more about him?
Well, he was a veteran, so there's stuff he did.
Yeah, so already this is different from a typical Jubilee video. You can see her smiling when Dr. K is responding to her. And this is often something you see in therapy when what you really want to do first in the conversation like this is just show empathy. And the way that you show empathy is by basically reflecting back what the person has just said to you. And so he's validating what she's saying. He's saying, look, you are broken to some extent because you've lost someone that you can't get back. And there's no way to get them back. And so to some extent you can't fix that. And it will remain that way forever. And she's also talking about how much of a presence, God, I'm not doing a great job of listening because I can't remember. I think it was her grandfather. How much of a presence he had in her life. And Dr. K is immediately validating her feelings there. So you've lost this person, and this is the presence he had in her life. And she's already smiling because she's feeling like, yeah, you really understand me. This is this is really the fundamentals of therapy, is showing curiosity, showing empathy, reflecting what the other person is saying, not interpreting anything, not solving anything, but just showing I'm present and I'm hearing what you're saying and it's understandable. Um, very different from a Jubilee video where I don't know, I haven't seen all Jubilee videos, but often someone has a point, they disagree, and they're just going back and forth about why you're wrong. And that's not what he did at all here. And now she's smiling and I think connected to him.
Didn't really talk to us about, but
Yeah.
he would take us camping and bowling. I mean, I was his first grandchild, so I kind of all my memories were kind of tied to him. Going to his house, having pie, even though pie's not the best thing to have for breakfast, but it was nice.
I think it's a great breakfast.
He would take me places. He would tell me like, "Oh, this is my favorite food. Let's try it. Let's go do this. Let's do that."
So another thing here, right? He's being really kind. And that's a big piece of how you can connect to someone. And she said, we would have pie for breakfast, even though it's not healthy. And, that is true to some extent, but at the same time, right, we're trying to connect to what's positive here, what she's feeling in her emotions towards her grandfather. And he says, I think it's a great breakfast. No reason to go into, yeah, you're right. It's unhealthy or whatever. We all know that, but he's just connecting to her. So that's great.
And when you lost him, what did you lose with him?
I guess my everything. I didn't know how to function. I mean, I have support, but he was kind of like the main.
So this is another great technique in therapy, but in conversations generally. He asked her an open-ended question. So what did you lose with him, right? There's so many ways that you can answer that question, and it's not a yes or no answer, right? He's showing curiosity, and he's giving her space to elaborate on her feeling, which is the statement, "I'm broken." And so he wants to know what does that mean when you say you're broken? What did you lose? This is giving her a chance to metabolize what she's saying. I also think this is not a debate format, right? So he's not saying, well, you're saying you're broken because you lost him, but it's really that you're overwhelmed, right? He's not leaning into the point that he's making. He's simply trying to understand her perspective here. Maybe he'll get into the "you're really overwhelmed" later, but it's going to be interesting to see how he does this, because a therapeutic way of talking really isn't about convincing someone else of your point. It's about understanding them.
Like the first person I would go to, and then he died of leukemia, and for me, my family was upset, and I was kind of trying to be stronger for them. So I didn't realize how bad it had got.
Well, it sounds like you were also present for your family when he
Yeah.
passed.
I didn't let myself mourn. I didn't let myself cry. I was more so like, it's okay, I'll be there for you. And then when they were done mourning, it kind of got to a point where I was like, maybe I can be upset about this. And it kind of triggered everyone around me. Like,
What do
hey,
you-
let's not do this right now. Like, I'm trying to relax. I'm like, hey, I'm hurting.
Oh boy.
Yeah. But it's also like they
So first
dealt
you
with it.
you chose not to mourn.
Yeah.
Yeah, so he's totally locked into what she's saying. You can see in his facial expressions and how he's responding to her that right now, in this moment, in Dr. K's universe, his conscious experience, he is locked into her. You can really tell that. I don't think he's thinking about "you're overwhelmed" at all. He's really trying to understand what she's saying, and seeing the significance of it too, right? He's saying, she said, "I didn't allow myself to mourn because I also needed to be present for my other family members." And he's seeing how that can have such a strong impact on her emotionally, in her process of grief, in her ability to move on and connect to her own pain. And so that's where he's going, I think.
Yeah.
Well, I mean, no wonder you feel broken, because I think you haven't had a chance to heal yet.
No. Not really, but I put it off to the side, kind of like he's there, and when I get older and my time comes, I'll get to see him again. That's kind of what kind of keeps me going, that, I'm being watched over.
So I think this is also really interesting, because you're kind of saying that what you will never get back, right? Because
Yeah.
that's what you're kind of thinking is this person who is safe.
Yeah.
And here we are. And when you start mourning, what do the people around you do?
They're kind of off. They're like, hey, let's not talk about it right now.
And I think it sort of makes sense. Like, I know this sounds crazy, but it kind of makes sense, right? Because if you weren't given a chance to mourn, if people didn't make you feel safe, if they didn't take good care of you,
Yeah.
and then you, like, literally, like, that's what happened, well, no wonder you would think that this is the only person that'll do it, because, like, he was the only one that literally did it.
Yeah.
Yeah, so he's totally validating her beliefs, right? When you lose the person that was the person that you confided in, that was your safety net, and other people can't fill that role, then when you lose him, how do you, one, you can't replace your grandfather, right? And so that's a really hard piece. It's just the grief of losing someone. But there's also this big role in your life, this safety net that's now gone, which doesn't give her the space to connect to her feelings and move on. It's a big loss, not just about him, but about her own emotional experience in the world.
That's true forever. Does that
No.
kind of make sense?
Yeah, but it's like I feel like for me it is because I don't address it. You know, I
Well-
kind of am like, okay,
So she's saying she doesn't address it, which might be true. But now here she is, she's talking about it. This is addressing it. This is why therapy can be helpful for many, many people, because what she's doing now is she's actually talking about her feelings. She's doing it with someone who's willing to actually hear her and hold her emotions and be with her. That is what good therapy is. And my guess is that this conversation's very helpful and healing for her.
okay, let's put it in a little box.
Well, that's because that's what the people around you told you to do.
Yeah.
If you can find that safety, maybe if you can advocate for yourself a little bit more. And I know this is tricky, right? Because the whole problem.
Yeah, so this is part of what we call family systems, right? So if your role in your family system is none of us can receive what you're feeling, you're not allowed to have feelings, then what you do is you lock it up, but then it sits with you and you might have depression or you might have anxiety, right? If you're not given space to feel your feelings, to talk about your feelings, to be heard and supported in your family, what people often do is they bottle it up and then they cope maladaptively, which means it helps you, but it's harmful. So people might cope with eating or drinking alcohol or sex and all of these things. And so what therapy does, right, is it becomes an interpersonal outlet for you to get these needs met in a relationship outside of the other systems in your life. Sadly, many people don't have others that can support them in a way that's helpful. And so that's why therapy can be important and helpful, is because it becomes part of your interpersonal system and it becomes a relationship that you're not getting from other people in your life, and that can be very healing. And that's what they're talking about now.
Here is that people have not been taking care of you. I think getting some degree of like anger and sort of like letting people know around you like how not okay it is
Yeah.
that you're hurting and you took care of them and like now it's their turn.
Yeah.
Does that resonate with you at all, or does it send you running for the hills?
Well, it does. I mean, like current issues, my grandma's health. I've been more vocal about being upset versus before, where I was like, "Oh, it's okay. He got to make a choice. You know, we should be happy for him. He can advocate."
And now that you're more vocal, what's
I'm
happening?
I'm more aggressively vocal, and they're like, "Okay, like we can't do anything about what she's doing." I'm like, "Why?" I guess I'm being more open about this feeling because it's in the now and not in the past.
Yeah, so I'm actually like somewhat optimistic for you. I know it sounds crazy, but
How could you? No, I'm messing with you.
because
So what would be interesting right now would be if Dr. K asked her, how are you feeling in this moment? And that's something I do with my clients a lot of the time, right? It's called processing the here and now. And I'm gonna I'm gonna move this. He might ask her, how are you feeling in this moment? And she might say, you know what? I honestly feel better. And I wasn't so focused in the last couple minutes on feeling sad or feeling broken or feeling depressed. I actually feel relief. My guess is that's something she would say. Now, it might not be 100%, but maybe a little bit. And when you start to see that there's a different way of experiencing the world and relating to another person, which is about you, right? Supporting you, that changes your relationship to yourself and the way that you walk around in the world.
because I think now you're doing something really scary but very different, which
Yeah.
is you are opening yourself up for other people to help you. And the real tragedy of life is when we open ourselves up to be helped by other people. Sometimes they meet us halfway, and sometimes they don't.
Yeah.
But I think give people a chance. Yeah, great.
We're going to pause here. Thank you.
Okay, so this is not a typical Jubilee video, right? Because they're not debating anymore that you're not broken, you're overwhelmed, right? He's not saying I'm right and you're wrong, right? He did the opposite. He actually said, look, feeling broken actually makes sense given what you've gone through. Um, I think it can be implied, right? Maybe she's overwhelmed, maybe she's not supported, and maybe she's scared to be vulnerable and to be open with the people in her life because she's been invalidated so much. You could call that overwhelmed. You could just call it, I'm not supported. But it doesn't really matter, right? What happened just now was a relational experience between the two of them that I think was moving towards healing for her.
Hey,
Nice to meet
what's your name?
My name's C.
C?
Yeah, C.
Nice to meet you, C.
Nice to meet you. So I'm a former foster kid, and for all my life, I I've lived differently from everyone else. Essentially, from
This is really hard because you've got cameras on you, you've got a whole room staring at you. You can tell by their voice that they're starting to get shaky. There's clearly sadness here. So props to these people for coming in.
surviving, I wasn't taught normal societal behaviors or emotions because I had to take care of myself while being in a dangerous environment. And what's interesting is that even though physically and mentally I'm fine and I feel great and I can do my daily tasks, interact with people, it's still stuck in my body. I feel the depression like right now I don't want to cry, but for some reason my body just wants to let it out. And before I wouldn't let it because growing up in a Hispanic
Yeah, so there's going to be a story here, right? That this person could have been the type of person that when they feel sad, they let it out. And there's such a strong defense mechanism here that is stopping the emotions from coming out. That doesn't come from nowhere, right? Babies aren't born into the world feeling that they're not safe to cry, right? Most babies cry outwardly and very loudly, right? And that's actually a good thing. It's how they learn that when they cry or when they're in distress, that they can be protected. That something or someone will come, right? The parents or the caretaker, that they're safe in the world. And this person learned over their lifetime that you cannot show emotion, and it's there. It's in there for all of us. And so we'll see what's behind this story.
culture, they'd be like, "Oh, ¿por qué te lloras? Like, why are you crying? Like, you want to cry? Okay, I'll make you cry." To where it was like, "Okay, like I can't." But the more that I would hold it in and push it down, the worse it became, until eventually I just let it out. It's like my nervous system and my mind are completely separate.
Yeah.
And they're going into different things to where my body doesn't recognize that I'm safe. Like now I'm safe. No one is going to hurt me. No one's coming after me. No one is going to physically or emotionally hurt me. But my body is still in that hypervigilant state.
So this is a trauma response. It can be the result of complex trauma. It can be a result of many different things. Complex trauma is not in the DSM-5, which is where we get our diagnoses. But when you have repeated trauma that has occurred to you over long periods of time, right? It's kind of like the death by 1,000 cuts. Then your nervous system reacts to that trauma by basically creating a shield of hyperarousal and stress, because you need to always be on the lookout for danger. And it doesn't, your nervous system can't distinguish between I'm in a library or I'm in a danger zone where someone might hurt me or attack me or insult me. When it happens over and over again, it's safer to be hypervigilant than to calm down. And it's a result of trauma. Not always, but often. And so this is where it seems like this person's talking about.
There are times where it's just becomes overwhelming. There are times where it looks like disassociation, night terrors, to where it feels like it's hard to trust or connect with people.
Yeah, so dissociation, nightmares or night terrors, these are all common symptoms of PTSD. Now, I can't diagnose this person, but generally speaking, these are trauma symptoms that can occur.
Whereas like mentally, I'm great. I just don't know how to. I've gone through the work. I go through depression. I'm taking antidepressants. I'm taking like multiple classes and courses and therapies, but I just
Circumstances that are traumatic lead to you having natural responses that can feel very distressful and very painful, and might look from the outside to be abnormal, right? Someone's in a safe environment, but they're still acting as if they're somewhere unsafe. And then you can add onto that this judgment, right? This is a broken person. I am broken. Now, that's not helpful at all. What really is true is that you've been a victim of trauma, which is not your fault, and your body is having a natural response to protect you. It's actually the opposite of broken. It means that you're functioning the way that you're supposed to in an environment that is unhealthy and unsafe.
When people grow up in a very traumatic environment,
Why are they showing that guy?
that thing stops communicating. You may experience that everything is fine. The left side of your brain, which is active right now, is saying, okay, we're at work, we're maybe like gonna go get some ice cream after work, and you're like living a normal life, but the other half of your brain is screaming.
Part of this is figuring out how do someone might come to the office and say, I understand this. I understand that my mind and my emotions are not connected, so to speak, right? They're saying, my nervous system is activated. My rational mind knows I'm safe. And so the question becomes, how do I establish safety? How do I get my nervous system to learn that I'm safe? So an example that I use with my clients sometimes is I ask them, when you're in the waiting room waiting for me to come to start the session, do you ever feel anxious or nervous that I'm not going to show up? And they always say no. And part of that is, the main reason because of that is because I'm pretty much always on time. It's something that's very important to me. I'm very consistent with this. I would say that at least 95% of the time I am on time, which means that they've learned that I'm reliable and that I'm going to show up. And so when they're sitting there in the waiting room, their nervous system isn't activated because they're not anticipating anything unusual, anything traumatic, any abuse, anything like that. And that's a proxy for what we want our relationships to be in life, right? We want relationships where our nervous system isn't activated all the time because we're afraid that something bad's going to happen. We're going to get hurt, or there's that inconsistency. Now, my clients would get very nervous if it had been 20 minutes and I haven't shown up for the door, because that would be very unusual. And that would also be an important response to have in that moment, because it's indicating that something is out of place, something is wrong. And so that's actually a good thing, right? With they're feeling that way all the time, or if they're feeling that way in the office all the time, it's probably less about them and more about me, right? If I'm the type of therapist that's rarely on time, that's first of all, I'll get fired. But if I'm mean, if I'm abusive, if I'm critical, if I'm all these things, they're going to be in the waiting room feeling naturally and understandably anxious. And so by creating a proxy relationship, the therapy relationship that's consistent and supportive, their nervous systems go down generally in the waiting room. And this is what we want to create out of all of our relationships, most of our relationships. It's not about saying we have to be safe all the time, but we're not meant to be in relationships where we're constantly hypervigilant all the time, unless we're in a situation where we need to be, right? If we're in a battle zone or something like that, yes. And then that gets to the bigger question of, on a societal level, why do we live in a society, what's going on in the world where people are so activated all the time? It's not necessarily that everyone's broken.
I think a big part of this, and the good news is that we can heal from this. What's really hard about this is how confusing it is, because you see like other people react appropriately to the things that happen around them. But literally what's happened is you have all of these pent up reactions that you've been carrying with you. And I can see that this is bringing up, what are you feeling?
I don't know what it is. It's just kind of just what I do is I normally just let it out. It's as if my body wants to cry, but I'm listening.
This is a weird format. In therapy, we wouldn't be doing the psychoeducation where we're talking and explaining things. We would just want to connect to their emotions, which is what Dr. K is doing right now, checking in. How are you feeling right now? What's going on? And clearly he's giving them space to feel what they're feeling.
Listening to you, and I'm not crying, but my body is.
Yeah, see, it's happening right now. And so when you feel this way, what do you do?
Before it used to be really bad, where I would like hit my forearm or hit myself and be like, no, you can't
Also
feel this
common.
way. To where now I've learned that I let it be, let it process. You know, if I'm gonna cry, it's like I even close my eyes and I go, it's okay, you're safe, no one's gonna hurt you. You can just breathe and I just let it out, because the more I let it out, the more I let it be, then it kind of goes through this like stress cycle and I'm able to like be myself again. And then after that, I go hang out with friends, I go outside, touch grass. It's the touch, sight, smell, and feel that I do to kind of be present.
You
And
figured
like,
all this stuff out on your own?
yes.
This is amazing.
Again, this goes back to why therapy can be so helpful, because you have another person in your life who is sharing the burden, so to speak, of your emotions and saying it's okay to be who you are. It's okay to feel what you feel. We can actually feel it together, and that's okay.
My parents didn't like me because I was gay, so they kept me away from society, kept me away from people.
Yeah.
Like they had me essentially say, you were essentially a demon, so you need to stay in this area and this is how you should act and be. You are quiet, you are
So messed up.
so that's what I've learned, and now I'm trying to readapt to it. And the biggest thing is feeling my emotions. Like this I can control. This like it's so hard.
So this is another layer that's it's even more traumatic, right? It's not just that you're not allowed to feel your feelings, but you're not allowed to be who you are, right? So I think they said they're gay, and you come from a family system in which being gay is demonic, apparently, right? So not only are you not allowed to be who you are emotionally in any given moment, right? To be sad, but you fundamentally who you are as a person, that is demonic and that is not allowed. And so that creates an even bigger dissociation from yourself. It's not just your emotions, but any emotion you feel in that case, whether it's happiness, sadness, anger, anything really becomes seen through this lens of no matter what I do or who I am or what I feel, I'm demonic and I'm bad. The level of shame and just shame and trauma that puts onto a person is immense. This goes back to the original question, right? Are you broken? You're not broken, you are overwhelmed, right? In this case, is this person broken, or is maybe their family broken, right? What is it?
Sometimes this can be a therapist. Sometimes it can be a friend. I think it can look a lot of different ways. Tragically, you were not given that growing up. And I think this is
Yeah, so this is where therapy is a good starting point, because for people, often people, I've got clients who come in that don't have any friends. They don't have a relationship with their family because they're not safe. And so the reason therapy can be helpful is because you learn how to have a relationship with somebody who is safe and who is reliable and supportive. That starts to change your brain and your mind and your emotions so that you can start to actually trust other people. You can start to see the signals for what is healthy, versus many people don't know what that is. And so they get caught up in toxic, abusive relationships because that's familiar to them. And so once you start to have a different kind of relationship with somebody, it really opens up the repertoire emotionally within you for how you can navigate the world. And you can say, you know what, I like the way this feels in the room with a therapist. It feels supportive, it feels safe, they're listening. And so when they meet someone in real life who does similar things, right, who feels safe, who does listen, that feels more familiar, and they can actually become friends with them, or even in a relationship with someone like that. And it opens up your ability to connect with people on a different level.
I have treatment resistant depression, but it's not for the lack of wanting to be treated. I would
So treatment resistant depression means that even though you're going to get treated maybe in therapy or in conjunction with taking medication, your depression remains. Now, there are some people that I've seen this where they've been depressed for many, many years. So the way we diagnose persistent depressive disorders, it's lasted at least 2 years consistently, so more days than not. And there's symptoms for depression that are part of it. But um it's interesting that she says my depression, right? So she's already kind of identifying it as being something that's a part of her. That can play a role, right? If you see yourself as I have depression, my depression, it becomes more difficult to kind of disconnect yourself from it. And you can kind of go through the world feeling as if this is something that is part of me.
do anything for something that works, but like nothing has. Like it's like my mind is, I feel like, is searching for more reasons to be depressed sometimes. And also, I relate to the dissociation. Like half of me is like somewhere, and the other half is like super depressed. So, for example, I'm a musician, and how I cope is actually writing about this really deep, dark stuff like suicidality and stuff. I write about that. I was at a show, and the show was going.
So I'm not saying this is a bad thing, but it does say something that part of what's meaningful in her life as an artist, as a musician, is writing about depression and writing about suicidality, she said. Now, if feeling suicidal or feeling depressed is part of the outlet in which you express yourself artistically, then it's going to be harder to let it go, right? Because then you losing something deeper within yourself that's creative, that's artistic. And I'm not saying this is the full story, but I don't, it's something that I would be mindful of if I was working with her.
Objectively really well. Sorry. Yeah, I just looked out at the sorry, I don't even know why I'm crying right now. Objectively everything was good. I just looked out at the crowd, and I felt so empty. So I'm doing the thing that I love, yet I still felt, God, I feel like I've never felt more alone.
And then
Why am I still not?
Yeah, right. So I'm almost like thinking about how hard it must be for the things in life that are supposed to feel really good
Yeah.
to feel so alone.
Yeah.
Right? How do you understand that your mind is searching for reasons to be unhappy?
Well, I'm super judgmental of myself.
Okay.
So
Yeah, so I'm not entirely sure where this is going, but there is something about, she's saying, I'm performing, there's an audience, and I feel so empty. She's also saying on some level that she's searching for reasons to be depressed. And so there seems to be this kind of internal conflict. There's a part of her that wants to feel better, and then there's another part of her that is kind of leaning into the depression, leading into the sadness. So I wonder what she's going to say about that.
my self-talk is like very negative. I'm sort of like at a constant like argument with myself, so it's like, but I'm also like, I know that I have to like.
There's a part of her that doesn't allow herself to be happy. I don't know what's going on there, the dynamics there, the history, but if there's a part of her that's constantly denying her happiness, that's constantly trying to find reasons for her to feel miserable or even suicidal, then even when she's doing something that should be, as she puts it, right, objectively positive, performing music, which she loves, there's a mechanism that stops her from allowing herself to feel that, which can lead to emptiness, right? It's not something that feels sad overtly, right? I'm doing something that's happy, but I'm going to deny myself the feelings of happiness. It's very similar to someone who doesn't allow themselves to cry. They're often going to say, I feel empty. It's not that I feel sad or happy. I just feel empty, right? Because when you feel empty, you're not going to laugh. You're not going to cry. You're going to deny yourself any emotion. And so there's a part of her that says, instead of being happy, allowing yourself to go there, to reach that spot, there's going to be an emptiness to fulfill what, it's hard to feel, overtly depressed or really, really down in a situation that would warrant happiness, if that makes sense.
Like I'm doing what I love, right? Why is my brain, it feels like it's like looking for reasons to be upset.
So here's one of the tricky things I've learned as a psychiatrist, and I've worked a fair amount with people with treatment-resistant depression. I think there's 3 patients that I've worked with that I really have not been able to help that I can think of, and I remember them very well, and we tried really hard, and I think I hate that. But
what do you do about something like that?
Tried all kinds of things. But I think the good news is that, for the 3 patients that I've worked with who have treatment-resistant depression, I've worked with 50 to 75, that things have worked. And the one thing that I would really tunnel down into, just because we have a little bit of time here, is to really pay attention to that part that is searching for a reason to be unhappy. So don't argue against yourself, but try shifting your attention away from that towards other things.
I've
to be,
definitely tried.
and I think that that's a skill.
And it sometimes it works.
Right. So if it works sometimes, then that's where I think learning to be better at it can offer some relief.
It's just the fact that it always goes back.
That's where we get to part number 2.
Okay.
Which is to understand why your mind, there's a part of your mind that is really, really unhappy with being happy.
Yeah, so this is not a conscious choice that she's making. I think it's primarily mostly unconscious. This is how it is with most of us. There's some underlying dynamic that was probably triggered early on in life that is denying her happiness. And even when she can sometimes shift her perspective or reframe something, it works a little bit. Her general her general disposition is to fall back into that place of denying her own happiness. Now, this is going to take time, right? This isn't something they're going to figure out in this 1 minute where they're going to talk on this format. So I think going to therapy and working through that could be very helpful. So there's a new statement. Hopelessness feels like a conclusion, but it's actually a symptom. Yeah, so hopelessness is a symptom of depression. People who feel hopeless often feel depressed. And what that means fundamentally, right, is that when they imagine feeling better, or they imagine a future that is happier, or where they're doing something, their life feels like it's something better, they don't feel that way, right? There's no point. Nothing's going to change. As you might imagine, that is often a feature of depression. And so in my work, part of what we do is work to instill hope. And that often comes quite early in therapy. They've actually found that people start to get better after the first few weeks of therapy. And the reason is because they've started to feel hopefulness again. So even though nothing big has happened in their life, they're not cured. It's only been a few weeks. They start to feel more hopeful again.
Part of my issues is that when I am super depressed and I'm at the depths of everything, that's where it feels like there's no way out. And so is this a symptom of something that's bigger, or is this my final state? And so that's where I get stuck, because I know that it's a symptom, but the overwhelming thoughts is like, this is my conclusion, this is where I'm stuck, and there's no escaping this. That's where I feel like I can't gain the traction, even though I know I'm supposed to, and I have the skills. And
our emotions often lie to us, right? So when you're depressed, you feel as if it will never end and things are terrible and they're never going to get better. And it's not true. When you're anxious, you feel like, I need to get out of this room. I'm under threat. Something terrible is going to happen. And it's often not true. And part of the hard work in therapy is getting over that hurdle. So with anxiety, you might be in a situation where you feel anxious. And part of what we do in exposure therapy, which is a part of CBT, is we say the thing that you want to do to escape the anxiety is actually the opposite of what you're going to do. So if you're feeling anxious in a movie theater, obviously if there's a danger, if there's something going on, then leave. If there's a fire, leave. But if you're just feeling anxious there and you want to get out, by leaving the theater, you're teaching your nervous system that theaters are not safe. And what we want to do is actually, it can be very painful, right? Is to say, I'm not going to listen to the anxiety and then the thought in my head that says, I need to get out of here to feel better. I'm going to sit with it. I'm going to wait it out until eventually, right, after some time, your nervous system will calm down. Your body will relax if the situation is genuinely safe. And with depression, it's a similar thing, right? I can't get out of bed. I can't shower. I don't want to do any of this. I feel so terrible. Part of this is just doing something that's going to counter the emotion, that's going to talk back to how the emotion is lying to you. And you say, you know what? I'm still going to brush my teeth. I'm still going to get dressed. I'm still going to take a shower. I'm going to go for a walk. I'm going to call a friend. I'm going to do something, right? It's countering the emotion.
It sounds like you actually know on some level that this is a symptom.
yes.
You've worked with doctors, you've learned the skills, in your head, you're telling yourself, oh, this is just a symptom. This is not a conclusion. You try to disbelieve yourself.
Right.
And then what happens?
Well, then that's where 'cause I've made more progress. I'm not as stuck as I was, and thankfully, but I still have to work on this all the time. It never goes away, and I wax and I wane. So when I'm feeling like I can't gain traction to get out of here, and I don't know what my next steps are, it gets so scary that it's almost like a self-fulfilling prophecy. I can feel it dragging me backwards, and that led to ultimately to some very, very deep depressions, suicide attempt, the loss of my employment. And so that didn't help.
Not only do you have the symptoms of depression, you actually have something else on top of that, which is a lot of blame for being depressed.
Yes.
After all, you've put in the work. You tried everything, right? And it's a skill. And the every day is, oh my God, it's like every day is a struggle.
Yes, this is the added layer, right? Of I maybe have a symptom, like I feel hopeless, or I feel down, or I feel sad, or I feel low, or I feel tired. Those are symptoms, right? The added layers when we judge ourselves and we say, God, now look at how much of a depressed person, I'm a failure. I can't get myself to go to work. That's another step that we take, and it usually self-serves and fulfills the depression, right? We when we feel sad, we judge ourselves for the sadness. We come to some conclusion about how bad we are, which then facilitates even more sadness, and it's just this cycle that just leads us downward.
I don't know if this makes sense. There's the depression that you feel, and then there's the way that you argue with yourself about the depression.
Yeah.
The way that you judge yourself for having the depression. What I think is really interesting is that's what's keeping it alive. Do you kind of get that?
Yes, absolutely. And I've worked on that with my doctors. One of the things that my doctor and I used to talk about is I feel like what worked for me to get traction going was I was going to fake it till I make it. I'm going to act like I'm happy until I'm acting happy,
Okay.
Something I said, and something a lot of therapists will say, and I've talked to people who go to therapy and they get annoyed by this, right? Because they say, well, I'm feeling depressed. And the therapist says, all right, well, go for a walk, call a friend, right? Like I just said, these are coping skills, but they don't get to the heart of actually changing the perspective that you have of yourself as a person, right? I think the next step is saying, okay, I'm going to go for a walk, and now I'm going to consider, why is this important? What is meaningful about going for a walk or calling a friend that shapes how I view myself as a person, right? If you're going for a walk and you're still feeling like telling yourself, I'm a failure, look at me, I have to go for a walk to feel better because I'm depressed, that's different from saying, you know what, I have a different relationship to myself that I can feel bad, I can feel low, and I still care enough about my life that I'm going to take this step to go out for a walk and get some fresh air, because there's a part of me that deserves to feel normal, that deserves sunlight, that deserves to take care of myself. That starts to change the underlying dynamics and framing that you have of yourself as a person. That's getting us out of judgment to a new, healthier sense of self.
We think that we have to feel better in order to do more, right? I want to feel better so I can get out of bed.
Right.
Whereas there's a lot of evidence that shows that sort of faking it till you make it actually works pretty well. That when we step out of bed, when we force ourselves out of bed, the feedback that we get can actually be helpful. So I can totally see why that has been helpful for you.
Yeah.
I think the thing that scares me the most and feels so oppressive, Joe, sitting with you, is that just how much you have to work to have a normal day.
So this is a good thing that Dr. K is talking about his own feelings, that he feels there's something that feels oppressive with Joe. And that's a great thing too, right? Because if Dr. K feels like there's something oppressive about the way in which Joe is speaking about himself, then it probably means that Joe feels similarly about himself. And that leads to this feeling of being overwhelmed, what was at the original point, right? That there's an oppressive nature to how he judges himself that Dr. K feels in this moment, right? So he's using his empathy to understand how the content of Joe's mind shapes his feelings. It's good.
And then getting out of bed, it's really changing the way that you relate to your depression. That this is something that sometimes happens to me for whatever reason. I'm cursed in this way, which I know sounds crazy, but
Right.
sometimes it can be useful to even think about it like that.
Right.
But ultimately, changing that self-loathing is going to be a huge step forward.
Yeah.
Pause here. Joe, thank you so much.
absolutely.
It's time
Yeah,
to fix
I'm only like a third of the way through with this. It's an hour and 34 minutes. It's really, which is pretty, it's intense. I have to stop watching it now because I'm at work and I have things to do. So what I'll probably do is come back to it and keep watching it. Dr. K is great at getting the fundamentals down for what is effective in therapy. And I think that's something to learn as a person, that if you're genuine, and that's kind of vague, right? So what does genuine mean? So if you're having an interaction or a conversation with somebody, what genuine means is that I'm showing up and I'm going to be authentic and honest in that moment to how I feel, and I'm going to be present with them. And the next piece is I'm going to actually listen to what they're saying, right? Active listening. I'm going to be curious about what they feel and what their thoughts are and who they are as a person. And I'm going to ask open-ended questions so that I can get, we can learn more about each other. It's a dynamic process in which we're uncovering what's going on within them and reflect, right? Reflecting is the opposite of debate, right? Debate is about, I'm going to take what you said and I'm going to say, this is why it's wrong. And these are all the reasons. Whereas reflection is, I'm going to simply say back to you what you're saying so that we can gain clarity on what you're saying and we can figure out what's true about what you're saying, right? And that's the validation piece, right? Totally different from debate. Debate says what you're saying is invalid and this is why. Reflection is saying, and empathy, reflection and empathy is saying, this is what you're saying. I want to understand what you're saying. I want to indicate that I understand what you're saying, and I want to find something that's true about it, that makes sense. So props to Dr. K, and I look forward to watching more of this and reacting to it.